Hello, everybody, and welcome to episode 58 of the On-Air Advocate, where at the On-Air Advocate, we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. For those of you who do not know me, my name is Tammy Flynn, and I am the host and producer of the On-Air Advocate, and I am super excited that you are joining us here this afternoon, or if you're in Arizona, it would be this morning in that area for this live. Now, if you're watching it live and you feel that this content could be relevant for anybody, please hit the share button and share the love with others. Or if you're watching it on the replay, the same thing. Now, as we continue this deep focus series on mental health, I am so excited to welcome back Dr. Diane Grise. She is a naturopathic physician, and she is going to take us through more of that naturopathic approach. And I'm going to let you kind of take it away, Dr. Grise. Thanks for being here.
Oh, thank you for having me, Tammy. It's nice to be back. So basically what I'm going to talk about today is looking at, we have all these different conditions, different diagnoses within the mental health spectrum and within, psychiatric conditions, everything from anxiety to ADHD, even moving into things like dementia and age-related kinds of changes. And so what we see, if we can zoom in and look at all the differences and what symptoms fit which different diagnosis, but if we zoom out and look at the overarching theme of what is the underlying cause of most of these conditions, and we see some common threads. And so that's what I want to dive into today, is to how can we look at health in general, because it really is. And when we address some of these concerns through, our fatty acid levels and our inflammatory processes, not only does our mental health improve, but so does our cardiovascular health and our digestive health. And so this is really just looking at health and our system as a whole unit, and that we have to really approach it from a global perspective. And that's what you put into your body, but also what you think and how you think. Because that, I would argue, is in some cases even more important than what substances you're putting into it, because the mind is so powerful. So we'll dive into that a little bit.
Now, so mental wellness, and I've heard that term used a lot, and I think that's kind of what you're describing, that overall wellness of, our whole mental space and our body as well.
Certainly. And it's not just an absence of disease that we should be striving for. We should be striving for true wellness, which includes feeling joy, feeling passionate, feeling excited about life. It's not just, I don't have cardiovascular disease. You want to be thriving. And so we'll talk a little bit about how to best support yourself and being able to continue to do that throughout life.
That is awesome. So I'm excited to hear. I know that when we talked about our first discussion that we're going to have this week, because we're going to take it into two different parts, because you're going to be on again next week, that we are going to kind of dive into how some of those things, like you were talking about, the inflammatory and B levels and all of that can affect some of those other things like anxiety, depression, and that sort of thing. So where would you like to start with that?
All right. Well, I think the most important thing to start with is diet. I know that a lot of people have heard about, how important diet is, and it can seem almost too good to be true. Like how much could that really change how I feel? But most people who explore changing their diet and trying to figure out what foods specifically their system do not respond well to, and if they make some modifications. So for some people, it's eggs that really cause a lot of inflammatory processes. For other people, it may be gluten or dairy, or I've had patients that had things like lemon come up, or mustard that came up on food allergy panels that we would have never figured that out without doing the blood work. So sometimes it can be foods that aren't even technically bad, but they're for your system, it's creating an inflammatory process. So as naturopathic doctors, we are kind of, we call them foundations of health. What do we need to have in place before we start adding in even the B vitamins and the supplements, all of that? If you think of of our person. We want to include everything that is innate within us first, replacing things that may be deficient, as opposed to what we call exogenous information, such as pharmaceuticals or even surgeries, things like that. And so if we can support the innate balance within a person, then we have a lot less of needing to fill in the missing pieces. So that those foundations of health include nutrition, diet, as well as exercise or movement, our relationships, our interpersonal relationships. One of such a big challenge for so many people is feeling connected. And although we have this technology and we have all these, hundreds of different Facebook friends or things like that, but the true connection between people has really shifted. And so, talking about that with people and really encouraging, helping our patients and feeling confident in having these tough conversations with family members, their husbands or wives, about really having healthy boundaries with things like cell phones and social media, and really maintaining strong relationships. And for our older patients, social connection is something that, well, people across all ages deal with lately. But as we continue to age and loneliness becomes a big problem, because our children have grown and they have families of their own, and we're likely retired, not working as much, so we're just not around people. And our older patients often will feel really isolated. And so often one of the things that we'll do to help support them is build their social network, is really get them connected with support groups, bingo groups. I've helped some patients get into different kinds of volunteer work, things that fuel your soul. That's not just
and bring you value.
Body. Right. And feeling of contribution, which another big concern as we age, is just not feeling like you're giving back like you once did. And your life purpose can feel a little bit uncertain. And so reigniting that passion, that excitement, that care and compassion for other people, and actually being able to act on it. And so often people just need help finding out that these resources are out there, and there are so many organizations, so many support groups, things like that, that if we can just start the dialogue, start acknowledging that we're not doing okay, that we're
talking about it.
Exactly. And we have this idea that, it's all about positive thought. If we just shift our thought, which there's a lot to be said about that. The mind is very, very powerful, but to not have permission to acknowledge having an off day, and that's really concerning. We should be able to talk to our buddies or to talk to our family members and let them know, I'm feeling really stressed about this, even if it's something that you shouldn't be, or they may think you're silly or something, but we know that we want to feel connected. We want to feel motivated. We want to have that connection to others. So what we can do is simply start that conversation, and then we can hear that everyone around us is also struggling in their own different ways, and then we can build that kind of camaraderie of, okay, I'm here, we're in this together, we're not alone. And that's what people need to know. And I think if we were the underlying theme of what I hope to pass on today is just, we need to maintain connection and being authentic with what's really going on. If we don't acknowledge how we're feeling, we can never address it.
Right.
And so that's the first step, is really being willing to acknowledge it.
Open. Yeah. And I saw a post, I think The Mighty did it. They did a story on it maybe a couple of weeks ago, but they had a big post up and it said, it's okay to not be okay. And awesome. I think in the world of also caregivers that are caregivers on a daily basis, as well as people who suffer from possible different types of chronic illness that they don't get to leave the home a lot, there is so much of that alienation and that sadness and, feeling like you're so secluded and that you're the only one. And where is that value and where is that connection? And so I think you're so right. We do live in a powerful world that, for you to sort of be successful and to move forward, your mindset is supposed to be like steel. And I always say, you know what? you do need to move forward, but you need to know that throughout all the different little breakdowns, in life that kind of happen, the trials and tribulations, it's okay for us to have to go through that layer of sadness or mourning process,
Yeah.
or not be okay, and just be open to say it. Like, it's okay to not be okay for a day or so. It's more, which I don't know if you would agree, finding all those healthy resources so that on those days that we're not okay, that we feel like we do have people that can listen and we have some support system to share with.
Right, right. And that's a really good point, that in the moment when you are feeling really stressed, when you're feeling really overwhelmed, your thinking isn't as clear, which makes things even more difficult to try and problem solve. So what I found to be most helpful is, if when you're in a good place, come up with an action plan. Who are the people that you can call? What are things that you can do that are easy, feasible, and make a list. And we'll talk about this even more next week, as far as having a plan for patients who are feeling at risk of harming themselves. This is the same kind of approach we make as an action plan. But even if you have anxiety or panic attacks, or you have PTSD, or any kind of condition, there is things that worked for you, that you have likely had trialed different things and found things that some worked, some didn't work. And so when you're in a good space, when you're feeling calm, feeling centered, then you can make that list. That way, whenever you are feeling really stressed and really panicked,
Right.
you've got it ready to go. And then you're like, oh, I remember now that a nice cool shower feels really good and helps reconnect me and get me centered. Or, you know what, if I take my shoes off and put my bare feet on the ground, I feel so much calmer. But in that moment, I forgot all about how easy it was just to simply go outside and be grounded on the earth. And so you have it on your list, and you remind yourself, oh, it's as easy as that, or it's as easy as calling my sister, or whoever it may be.
Right. Now, going back to what you were talking about with the health within different foods and substances that we put in our bodies, would you say, obviously there can be that inflammatory reaction or allergic reactions or foods that don't adjust well with their bodies, but have you ever found, or in naturopathic research, that having some of those wrong foods can actually kind of add to a sadness state, depressive state, anxiety, that foods have the power to do that, or different enzymes that are in our foods?
Certainly. So some of the research looking into this, I would say the strongest research is with schizophrenia.
Okay.
And so with schizophrenia, gluten has been shown that patients who have schizophrenia have a higher rate of the autoimmune reaction to gluten, but they also have a worsening symptomatology with eating gluten, and their symptoms decreased when they removed gluten. So of course, this isn't 100% of patients who have this diagnosis,
Right.
but statistically, there was a higher percentage that had this sensitivity than those who did not.
Okay.
And so when I think about that, if you think of schizophrenia, it's with having delusions, hearing voices, it can be visual or auditory hallucinations, things like that. So it's the brain and a hyperactive kind of state. And
Okay.
so we also see with things like Alzheimer's, dementia, where they will often have symptoms of aggression, and this there can be some similar symptoms where they can hear people who aren't there and things like that.
Right.
And we see with Alzheimer's patients that many of them will improve when we remove gluten from their diet. And so it's as far as the mechanism, that this is still being researched quite a bit, as far as how this protein, it can interact and cross the blood-brain barrier. That protein itself likely is not, but there's an enzymatic reaction that is triggered by that protein in some people. And so across the board, I try and encourage people to reduce or remove gluten just for a trial. Give it 4 or 6 weeks, and ideally, exactly. Ideally, you would remove the top 6 food sensitivities, which is wheat, gluten, corn, soy, dairy, and eggs. So that's a lot. I know it can be tricky, but there's plenty of many different foods that are still available to eat whenever you remove those. And so we'll simply have a patient remove those foods for about 4 to 6 weeks and see what changes. And if nothing changes, then it's unlikely to be a dietary
factor.
contribution. But I have rarely, if ever, had somebody not had a positive reaction to removing those things. Now, what we do after the 6 weeks is then try to reintroduce one food at a time each week. So then, they get to pick. So maybe they really miss their eggs and they want to try and get those eggs back in. So that first week they would start with eggs, reintroducing, and then they would see. I have seen chronic sinus congestion and mucus creation, a lot of, sinus stuff or allergies improve, but even things like anxiety and sleep issues, their energy levels improve. So things that people can perceive, feeling fatigued as being depressed. They just feel run down. They're not motivated. They're just, and so they have not, there may be nothing in their life is going on that would make them feel sad, or they can attribute to why they would feel sad. They don't know why. They just are exhausted. And after long enough of just waking up in the morning and feeling like have no gas in your tank, it wears on you. You don't want to socialize. You don't have the energy to exercise or to cook meals like you used to. And so everything in your life can change. And maybe that fatigue is because you have anemia, or you have an underactive thyroid, or it's a physical cause that's just making you have the symptoms of depression or of anxiety, or it can go across the board. And so that's something from a naturopathic perspective that we really want to ensure that we're treating the cause, which requires us to do some investigation. We can, so you have these symptoms of anxiety, such as, a lot of people will feel respiratory changes. They'll have shortness of breath, and they have heart palpitations, and they're getting really flushed or having cold, clammy hands. And those symptoms, all of those symptoms, can be created by having low iron, being iron deficient, anemic.
So making sure that you're not missing what the cause is, like misdiagnosed, that it could be because of something else. And with those food eliminations, would you say that it would be more advantageous to do one food at a time that you were removing, like that you were removing one at a time versus all at a time and then adding back? Or does it work better the reverse way for people? Is that why you suggest that?
You certainly could do it the other way. You could certainly, remove that one food for several weeks and see the way that because we do it the other way, it just makes it a little bit more expedited, where we can, and if there are multiple sensitivities, then we just remove the most common ones altogether, so that then we can see that if maybe they have a sensitivity to egg and dairy and they just remove the egg, then they would have a mediocre response to removing only one of them. So if we just get a clean slate and we remove all 6, or if there's some people have things where they know that they're sensitive to, such as almonds or something, so we would of course have them add in anything that they know they don't react to remove during those 6 weeks. And then that way, when we reintroduce, we've got a nice clean slate, and we'll be able to see symptoms usually very quickly. So even things like eczema and acne can improve dramatically. Certainly digestive changes are very, very closely related to food allergies.
Okay. And, overall I would say when we talk about mental wellness, we know that eating better and moving our body is so important. And I, myself can never stress that enough. I know that probably on the first time that we talked a little bit about my son underwent a full spinal fusion about 2 years ago, and he lost 40 pounds. He had to lose 40 pounds. He lost 60 before surgery. And every single lab he had went back into the normal range. His energy level skyrocketed. His emotional stability level skyrocketed. And I have seen it before with myself in improving health, but I think when you're the outside person and you're the caregiver looking at someone, you can really see the change. And that's why, I'm a big advocate to always say, when you're feeling, down, when you're feeling kind of lifeless, watching that diet and getting out there and moving, because I think that attributes a lot of times to a lot of the feelings we have going on inside of us.
Certainly. And, the research on exercise, and we talk about an abundance of support. The data is so clear. I mean, for reducing the risk of cognitive decline as we age, to treatment of anxiety, depression, across the board, cardiovascular disease, respiratory illness. So exercise is vital. And even if you can't get to a gym, just moving. Even if it's in your living room, doing some stretching, just getting in your body. Because that's what a lot of this is. We all are up here. We're up here and we are not down in our body, which is why I like to recommend things like the grounding techniques. Just getting, we walk around with these thick rubber barriers between us and the earth. And likely that rubber under our insole is followed by many inches of concrete and cement and things like that. And so if we can just take time to get our bare feet on the grass, on the earth, on the dirt, it is so helpful and you feel so much calmer. And so this is something I encourage, of course, depending on the time of year and where you're living, it may or may not be.
Right. In Arizona, it could be detrimental, and in Wisconsin in the winter.
Yes, different problems. So there's some tricks you can do at home. And so other grounding techniques that I really like to encourage are taking baths, doing Epsom salt baths. You can add Epsom salts and a little bit of bentonite clay, which clay is earth. So you can add just a little sprinkle into the bath, and you sit for 10 or 20 minutes, and it's a really nice grounding exercise. And even if you just want to take a regular bath, once again, setting aside the time and being still with yourself and just taking the time to be okay, not on your phone, not multitasking, just being instead of doing. And you really need to get back into a more what we call parasympathetic as far as our nervous system, and that rest and digest, relaxed state. And most people only experience parasympathetic while they're sleeping. Throughout their day, they are in a very sympathetic dominant state, which means your heart is racing. It's that feeling of adrenaline and epinephrine, which is you are going. It's the fight or flight feeling, like when you're excited, it helps us get things done. But when our nervous system is shifted to a sympathetic state all the time, of vast majority of the time, it wears down our stress reserves, our ability to respond well, our ability to sleep well, and our system becomes on this almost hyper alert kind of state. And therefore, you sense it as anxiety. And so a lot of times it's the physical feelings of our heart racing. That's the adrenaline that's running. And then you feel those symptoms and you think you're anxious. You perceive it as anxiety. And so that all comes down to the adrenal glands. And so looking at how we balance our cortisol, which is our stress hormone. And so this is something that can be tested in labs. Also, there's some certain symptoms that we can ask patients. So some of the common symptoms of adrenal insufficiency, or likely having an abnormal secretion of cortisol during the day, is a symptom where if you stand up very quickly, you get really lightheaded. It's called orthostatic hypotension. So dizziness on rising. And then the other really common symptom is what people call white coat hypertension, which means their blood pressure is normal when they're at home, but whenever they go to a doctor's appointment, it's off the charts. And the doctor is always worried and saying, oh my gosh. And they say, oh, I assure you, it's just because you're taking it. So what does that tell us? That tells us that the stress of that doctor was too much for your system to tolerate. Just like the stress of gravity from moving from a seated position to standing was too much for your system to respond to. Instead of the blood pressure going up to keep the blood going to your brain, your blood pressure drops, which makes you feel dizzy and woozy. So all of these are just signs of you not dealing with stress well. But they're objective. We can measure them. We can see them. And so then we have a clue as to what's likely going on. And so most people produce enough cortisol throughout the 24 hours of the day. It's just they're putting it out at the wrong times. So in the morning, they may be putting out too little, which makes them feel really tired and a hard time getting started in the morning. And then their cortisol is highest in the evening, which makes them feel that second wind of energy. And they're anxious, they're restless, and therefore they sleep really poorly. So this vicious cycle is created. And so there's things that we can do to bring it down at night and boost it during the day. And we can get a person's cortisol rhythm back to the normal state. And that is a huge thing that we often will do with different kinds of mental health concerns, because underlying the development of them is chronic stress. I mean, the stress is likely had been there before the symptoms really progressed. And so we can look at that, and instead of just treating the symptoms, trying to look at what likely was one of the contributing factors.
Right. That kind of tipped it over the edge when we sometimes that stress gets to that point that it just takes it right over the edge. In talking about this, I just think so much as you're speaking to how we all run our bodies on a daily basis, and we just move fast and we move fast and we move fast. And it all comes back to that self-care. And I know Maria was on last week. She kicked off our series, and she's a mental health counselor. And, we had talked a lot about that self-care and bringing, being able to find those action tools of how to bring our minds, down in our body, and that recentering. And now you're talking about like the different testing and whatnot for those cortisol. It's cortisol, correct?
Yes. Cortisol.
Within the body. How do you go about testing for something like that?
So there's different kinds of tests that we can do. The test that I most often do is a salivary test. So we would send a kit. You would take the kit home, and it's got 4 tiny little vials in it. And so you would spit into it. Requires rather a large amount. It takes some effort. So you got to spit into the vial first thing in the morning, and then around noon, and then I believe around 4, and then around 8 p.m. So it's it's going to graph it throughout the day. So because if we just we can measure cortisol in the blood as well, but it's just a snapshot, right? It's just what is happening right now in this moment. But cortisol is supposed to have this nice curve throughout the day. And so if we only get one data point, it can be hard to know what's really going on. Unless it's really abnormal, then it definitely can lead us into the right direction. So the salivary testing makes it easy, and you don't have to get a stick, which makes it nice. And then there's also urinary metabolites, which is they can test the urine and see metabolites of things like epinephrine and norepinephrine, our stress hormones and our adrenaline kinds of hormones, as well as other kinds of markers to see more of an indirect measure of these kinds of adrenal function. And you can extrapolate the data to what's likely. If we see serotonin being very high or epinephrine being very high, then it can help guide our treatment as well. But the salivary test is one I use most often.
Now, obviously, the goal is for us to all be practicing that self-care, having an action plan, starting to utilize some of these tools in our life before we hit that breaking point. When we talk about naturopathic medicine, if we're kind of past that point now, we're kind of at the breaking point, or we've kind of broken a little bit there. With some of those approaches, do you think at that point that it's advantageous to then seek out regular conventional medicine until you kind of have gotten things back in order? Or do you think at that same time, especially if like families are listening to this and maybe they have, other family members that do have a mental illness that is actively going on right now, do you think when something is actively going on, that removing some of those foods, doing some of those different tests you were talking about are of value? Or do you feel like once someone is kind of at the tip point already or over, that it's better to deal with that in more conventional medicine ways and then go backwards after?
So, Yeah, it's a good question. And I think certainly different cases will be, if it's a really extreme pathology, really quickly worsening, things like that, there's a time and a place for pharmaceuticals. There's a time and a place for inpatient hospitalization. There's a time and a place for all sorts of more vigorous kinds of interventions.
Right.
But I have also been challenged with trying to get people off of pharmaceuticals can be very, very challenging. So in my world, I like to try and I consider pharmaceuticals as more of a last resort. If we need to move into, a benzo or something like that for anxiety, now they have really short half-lives, some of them, where the rebound anxiety as that medication wears off in your system is way worse than your baseline anxiety before you even took the drug. It's just the mechanism of how some of these things work. So therefore, it creates such a dependence where now you feel so much worse without taking the drug that trying to taper them off and get them off of that medication can be really challenging. But once again, there's a time and a place for it. It's very good at what it does. But if you take it away, the problem is still there, which tells me we never addressed it, right? We've never dealt with it. And so what I encourage, so if we talk about depression, anxiety, for so many people, there is unresolved grief that is the underlying cause of their depression or of their anxiety. There is unresolved conversations with family or different things that counseling could be very helpful for, that things like EMDR is eye movement desensitization and reprogramming. And we can include a link on this. There's tons of research on EMDR with PTSD, but also I have found it to be fantastic for anxiety. And so this is something that a therapist, a licensed counselor would do with you. And it's basically a way of working, you literally eye movement, so that you're going to look right, left, following a light bar or following their finger. And it's a way to basically distract the front of the brain, which is our thinking side, and allow our subconscious, the deeper parts in the amygdala where our emotions and these things are stored in our bodies. So from a trauma that maybe happened 10 or 20 years ago, where we are still being triggered, even though perhaps somebody called us an idiot, someone we really loved, and it really gave us a poor sense of self. And now when things happen in our daily life, it's like as if that just happened, that feeling of shame, that overwhelming pressure in the chest comes up as if that person from 20 years ago just said it, although it was a coworker who meant nothing by what they said. But that reaction is still within us. And so that emotion and that memory is still within us. And EMDR, which is why it works great for trauma, EMDR is a way to bring that memory up and out of the body. And so that mentally, of course, you remember the things still happens. You can't change the circumstance, but the physiological response to it, the feelings of racing heart, the difficulty breathing that you once used to get when you would think about that memory, they no longer come up. And so you kind of clear the physiological response to the stress. And therefore, their ability to deal with life, to not be re-triggered, now they have a new kind of standard of stability, because they were once living in like 7-year-old them, right? That memory was still running the show, that subconscious response of feeling inadequate or feeling insufficient, whatever it may be, that is running the show. And so we have to clear that away. And then their ability to deal with their life often is so much better. And so they are often working with different kinds of counselors, different kinds of practitioners to create a whole system kind of support for the individual. But there are also lots of herbal treatments that can be very effective, like ashwagandha, lots of research on ashwagandha and turmeric, which are working to help calm the nervous system. But turmeric has an anti-inflammatory response to it, which is the main way it acts. And just by decreasing inflammatory processes, we see improvements with things like anxiety and depression and even bipolar disorder. So there's many things that we can do from a natural point of view. The important thing would be, as far as if a person should seek medical, pharmaceutical intervention, perhaps if they don't have a very strong support system around them, perhaps financially or logistically, it just wouldn't make sense or be possible to get regular counseling or to seek alternative treatment. Maybe they can't afford the supplements or the office visits. And so things like that, there's certain situations where just going to conventional may make more sense, or if there's just no access to it. But when possible, we want to try and see if we can, by decreasing their inflammatory processes all over, by working on their internal dialogue, their sense of self, really trying to address if there is some unresolved grief or feelings of shame or whatever that has been there since they were 3 or 4 years old. Sometimes I've heard people say that they have felt this way since that one babysitter said that one thing, and they have carried that through their adult life. And so we can medicate them from the outside in all we want for the rest of their life, or we can get to that underlying emotion, help bring it to their conscious awareness, and then help them work in trying to reframe what that is and reframe how they think of themselves now. And then that depression suddenly isn't even there. It was just a feeling of inadequacy. And so sometimes it's really comes down to, a really good counselor, a really good therapist who can help identify these false beliefs, is what I like to call it, false beliefs of self, that you're just, because it's not true. It's not true. And we know that when we're in a good place, we know that we're here for a reason. But when we've had things happen in our life that just make us question our worth, our authenticity, what we're here for, then if we don't change that, then we're fighting an uphill battle, and we would simply be suppressing the side effects of that false belief, as opposed to just figuring out what that false belief is, looking at it and really figuring out, can we let this go? Is this truth or not? And often people are like, oh my goodness, I can't even imagine that I would tell myself these things. Why would I tell myself these things? I'm literally beating myself up. But if it's all you've ever known, and you've not had somebody be able to help you work through that and figure out a way to reframe that internal dialogue, then it likely will not change, because we're creatures of habit, and we can get into these cycles where we just, it's like a loop running the same kind of message inside our heads. And it doesn't matter. And it doesn't matter what our friends and family tell us of how good we are. If we are telling ourselves these things, we're not receptive to these other opinions, these other options. So doing things like that will just allow you to have that opportunity to do something about it.
Now, with that sort of therapy, is that a type of therapy, that the eye therapy, a type of therapy? Is that something that you do on like a weekly basis, a daily basis, a monthly basis? And that's something that you're saying, obviously, your like licensed mental health counselor should be able to provide for you, but you're going to drop a link for that with some more information about it.
Yes. So EMDR, and this would, of course, depend on the case, depend on what exactly they're trying to treat. But most situations, if it's a trauma that occurred, many years ago, but it's still kind of within their system and triggering them, then they may come in for a couple of sessions and then have a week off to kind of process, or maybe they will have alternating, having an EMDR session, and then the next week is just a counseling session, and then another EMDR session. Or I've also had people that, some war vets and things like that, who had just rather more intensive kinds of symptoms and more acute kinds of symptoms, or somebody who had a recent car accident or a recent, physical altercation or something where it's really acute, then they may come in for a couple times within a 1 week time.
Okay,
and so,
kind of clear.
Yeah. And so just, finding a licensed counselor who is trained in EMDR in your local area is the best way to go about it. But I'll certainly pass on that information, and I can pass on a research article for you as well about the PTSD.
And then those other two, you said turmeric, right?
Yes.
And then what was the other one?
is ashwagandha. So ashwagandha,
Ashwagandha. Let's
yes,
say that 10 times.
ashwagandha, yes, and it is such a good herb. It is one of them. I mean, lots of herbs have been researched for mental health, but ashwagandha is a more gentle, kind of works across the board as a nervous system kind of balancing. It's great for anxiety. It's great for insomnia, and it's really safe and gentle that for most people they can respond well to. Some of the herbs have a high interaction with pharmaceutical medications, and so you want to be really careful about some really stimulating adaptogen kind of herbs and things like that. And ashwagandha is one that is well received by most people and is rather gentle. So it works very well, but it's, of course, nothing works great for everyone. And you would, of course, want to double check with whatever medications
with your physician that there's no contraindications to utilizing it. With those two, how are they administered to yourself? Is it something that you're dripping into like water under your tongue? Is it pill? In what format does that come in?
So ashwagandha and turmeric both are herbals that can be, often they're encapsulated, or you can get them as tincture, which is usually an alcohol-based tincture, which tastes pretty awful. A lot of the herbal
Well, you just said that.
that can be a little bit intense as far as the flavor. So the capsules just make it easy. And often you're going to be taking it a few times throughout the day. So then they're portable and makes it easy. They don't have to be refrigerated like some of the omega-3 fatty acids, which also makes it nice for a, if you're on the go kind of thing. And so you can do, of course, with food, using turmeric in cooking. And so you can include it in recipes, which I always encourage my patients to try and add in more herbs in with their diet, as opposed to just counting on the capsule. You can use it in different ways.
Okay. I'm going to practice that all day long today, saying turmeric and ashwagandha.
Nice. They're fun ones, huh?
Yes. So you'll drop some links for those below. And so for this segment, would there be anything else you would want to add about those, the inflammatory responses, to any of these other treatments? Or I feel like we've done a pretty good job of covering this, but you're the doctor.
All right. Very good. Well, the one thing I would just want to emphasize is we talked about food sensitivities, but beyond that, if we just look at quality of food, and this is something I talked about on our whenever I met with you last time, but I'll just mention it again for those who didn't get to see that, is the difference between omega-6 and omega-3 fatty acids. So the omega-6 is called arachidonic acid, and it sounds bad, and it is bad. It's a inflammatory kind of omega. So what we see is that foods conventionally raised meat and things like that will have a much higher omega-6 to omega-3 ratio. And so a lot of research looking at high meat consumption and inflammatory response is looking at high conventional meat consumption as opposed to high grass-fed or free-range chicken, things like that. The animals that have had a less stressed environment, right? We're talking about our stress and how our system, the way we think, the way we get sunlight, the way we get to interact with our friends and our buddies, that is just the same as what's happening with those chickens and those cows and those pigs. If they're really stressed, if they don't get much room to move, if they don't get sunlight, if they don't get to spread their wings and walk around and hang out with their friends, then they are going to be creating these high inflammatory kinds of processes within their bodies, and then we're going to eat their tissue. And so we really thinking about the quality of your food, and it does, even if you're not allergic or having a reaction to it, you can choose to eat more higher quality meats especially, and but butter too, right? If we have butter from a conventional cow, then that is the fat, and so we're getting all those the inflammatory processes and chemicals and things that can be added to their feed that is concentrated into their fat. Therefore, we're getting it in the butter. And so I like to mention that as our sourcing of food is really important, and trying to get organic. I know that depending on where you're living in the country, it may be easier or very difficult to be able to, even if you have options to organic foods. But pesticides and it very quickly moves into your system. I mean, if you look at the pictures of how they look when they're spraying these things and they're in full body hazmat suits, and then we're simply running it underwater and taking a bite out of it. So if we can take ownership over prioritizing our budget to accommodate for, even if we're eating meat less frequently, but a higher quality. That way we're spending the same, $15 a week or whatever, but it's the quality of it that is much better. And so that is something that we can all do. We can all find areas in our diet that just have room for improvement. And the one last thing I would want to speak about is being mindful of our wake sleep cycle. So being rejoined with our natural sunlight and sundown. So something that is helpful is to rebalance that circadian rhythm. So the pineal gland sits right back here behind your forehead, and this is where what we receive light from, and how we perceive what time of day it is, and therefore how much melatonin is secreted and things like that to help us sleep. So if we make a point to, within the first hour of waking, to get sunlight in our eyes. So that doesn't mean, ideally, if you can go outside, drink a glass of water outside without sunglasses on, you don't have to stare at the sun, but just having that sunlight in your eyes. We have so many receptors within our eye that gives us information to our brain. And so that will help with energy in the morning. It helps with boosting that cortisol in the morning, getting us awake, getting us, ready for the day. And so for those of us who feel really run down in the morning, try that. Just, even if you can't go outside, open up your blinds, let that natural light in, and then opposite in the evening, being really mindful about trying not to have these really bright lights. Most TVs have brightness dimmers that you can decrease that brightness in the evening time if you're going to watch television, or adding blue light filters to computer screens and to cell phones to decrease that amount of input at night, so that our natural circadian rhythm can happen. Because it's not just about sleep, it's about hormone production and all sorts of things that are dependent on having the right amount of light and the right amount of darkness and the right times. So that's an easy thing that we can all do that is free of cost and easily accessible.
That's awesome. You always have so much good content. I just love it. You're just giving us just this list of all these things we can actively do right now.
Yes, it is so possible.
Yes. And I know that last time we talked, is it still relevant to say that Costco, I know in your area, you said Costco does have a lot of organic foods.
Yes.
So depending on where you're watching this from, you're in Arizona, I'm in Wisconsin. I have seen organic. I don't know if in your neck of the woods you get more foods, than we get here in the Midwest, but we talked about that last time as being a great source of organic that is reasonably, reasonable for cost.
Oh, certainly. And they have the grass-fed beef and the chicken and all of that. So then the big freezer pack. So you just take out, what you need for that day or that week, and it makes it really easy. And lots of, frozen fruits, frozen vegetables that are organic. That makes it easy so that, if you don't eat it as regular, you're really trying to change your diet and it might take some getting used to, then buying a lot of fresh produce and then it gets bad and then you get discouraged. So having it frozen makes it really easy and ready to go, and, incorporating more broccoli and spinach and all those good things into your diet.
So we'll drop that link below as well. So you can go, they could probably, the major Costco Facebook or website, probably what they all service at the different ones. So people aren't driving around being like, is this here? Is that here? But that is a number one concern when we talk about, diet, even vitamins, as well as foods. A lot of times people say, it's more expensive, to purchase that way. I find, if you're ending up compromising your health in turn, you're going to spend a whole lot more money on insurance and doctor visits and everything else than just on a regular basis eating a little bit more healthy. But, we ran through so much of the aspects of self-care, today, things that we can also do for ourselves, foods, enzymes, inflammatories, all of that. Can you just chat a little bit about what we're going to be talking about next week?
Certainly. So next week, we'll be talking specifically around depression and suicide awareness and suicide prevention. So this is a really important topic that, with recently we've had, a couple of celebrities that have completed suicide that, some of us who maybe hadn't had a personal experience with it could, had that, and it certainly affected many people. And many people were really surprised at how much it affected them or how much it triggered them. And so what they found was actually the calls to the crisis hotlines and things like that went up dramatically after some of those instances. And so we're going to talk about resources. We're going to talk about these different hotlines, these different options and organizations within that go across the country that just give us as individuals, if we have a friend or a family member who we're concerned about, what do we ask them? How do we talk with them? What is the right thing to do or to say, or who do we call? How do we react to that? And so I'll go into some information about that, just so that, once again, right, if we can prepare ourselves when we're not in a crisis, so that when something does happen, we've got a plan. We're not trying to figure it out in the moment. Then I'm hoping just to empower individuals to feel a little bit more prepared for if they do have a family or a friend who they're concerned about, of what do I do now, and how do I support them, and what do I say, or what do people who have had these thoughts say they wish they wouldn't have heard. So there's a lot of information out there. So I'll dive into quite a bit of that next week.
That's wonderful. Now, if in the meantime, in this next week, somebody wants to get a hold of you, get more information from you, have some direct questions for you, you do have a website, right, that they can go to.
Yes.
Can you lend a little bit more info on that? Because I think they can request a time to chat with you, that sort of thing.
Certainly. So my website is www.drdianegrise.com. And so we'll include a link down here.
Mm-hmm.
And you can shoot me a message on there, or that will be forwarded into my email, or you're welcome to call the office and set up a time if you have any questions. I do a free 15-minute consultation, just if somebody is unsure of if it would be a good fit, or if I would be able to help them or not, or if there's maybe another clinician that would be a better fit for them in their area. But I do offer video and phone conversation as well. So even if you're not local, depending on the state, we'll likely be able to still work together and still be able to discuss your health concerns. So I'd be happy to answer any questions anybody has.
That is great. So we have lots of links to drop below today.
Certainly.
We're going to get working on that, and we will look forward to seeing all of you back here next week at the same time, same bat channel, all that good stuff. So on that note, if you want any more of our podcasts, YouTube tutorial videos, or any more information about the On Air Advocate, you can head on over to onairadvocate.com. Also, if you want to be part of our private On Air Advocate community, where we can chat and throw out resources and things daily, please, at the top of this Facebook page, you're going to hit visit group, and that will take you right over to our On Air Advocate community as well. So on that note, happy rest of morning to you, Dr. Grise.
You as well.
And happy afternoon to all of you here in the Midwest. You guys take care, and we will see you guys soon. Bye-bye.
Bye.